So I guess I don't know Clayton. Is he part of the KU team or? Okay.
Yes, Clayton is joining as my backup. He works at CPPR with me and works a lot with the Dolly Parton Imagination Program.
Okay.
And my Zoom has been doing some weird things, so I wanted to make sure I had someone here to pitch hit if I needed that. So should be fine, but just wanted to make sure there were no interruptions in the meeting.
Okay. Well, it sort of helps to know who's who when I'm watching this to be sure I know who I could call on and what they might know.
Makes sense.
There's Deanne and Mr. Wilson.
Good morning.
Good morning.
Oh.
I haven't met Lucas. He's with.
Lucas has joined the cabinet staff.
Okay.
So, good morning.
Are the staff all in their offices? Are you scattered around today?
Well, here and there.
They're in there. Okay.
Yeah.
I'll try to think of some other inane questions to ask while we're waiting.
And I'm gonna go off video briefly to finish my breakfast. Sorry. It's prolonged childcare drop off today.
Okay, I have an iPhone without identity. Is that
Hey, it's Renee Erickson. I have my grandbabies with me for a little bit, so I thought you guys didn't want to see that, but I'm here.
Awesome.
All
No,
right.
actually, that's very appropriate, Senator.
yeah. Thanks, Senator. Oh, now your name's there. We're in good shape. Is the legislature on recess? They are, aren't they? I've
Yes.
forgotten.
And I think I speak for Senator Erickson when I say I'm awfully glad we did not try and have this meeting last week on Friday morning at 9.
Was
That would have been brutal considering the late nights we had.
Exactly.
All right.
So we have
Should I
Delise.
go ahead and start the recording, or do you want to wait another minute to make sure we have?
We have our quorum, so I think it's 9 o'clock. Kim, you are welcome to call the meeting to order.
All right. Well, let me do that. Call the meeting to order. There are still a few people joining us, but we can move into some of the things like the minutes, and I bet everybody will be here by the time we get ready here. We do note a quorum is present of the cabinet members, and we welcome those who sit on the cabinet as our agency advisors. Thank you all for being with us this morning. We appreciate that. And as usual, we're grateful that there's interest all across the state, and appreciate those joining all around. So with that brief welcome, we have some minutes from the February 3rd meeting. I read them and I didn't see any corrections, but let me check and see if others might have seen something that needs to be corrected before we approve these minutes. If not, I would accept a motion from a cabinet member and a second to approve the minutes.
This is John Wilson. I make that motion to approve the minutes.
Okay, who would second?
This is Delise. I'll second.
All right, it's been moved and seconded. We are not going to take a roll call vote on that. We will do it by a voice vote. All in favor, say aye.
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 Are there any opposed? Let the record show that there was a unanimous approval of the minutes by voice vote. And, you know, we have just 2 or 3 kind of big items this morning. And at the center, in some ways, of the work of the cabinet is the early childhood block grant, at least in terms of money. I always think of it as the center, although there are certainly other areas that have grown over the last year. But I think we're ready to hear the recommendations from the panel on approval of fiscal year 24 early childhood block grants. Who's going to lead us through that? Is that Amy's going to do that?
Yeah, this is Amy Meek. Good morning. I'm going to kind of just start with just a little overview of the process that we've gone through since really since last fall. We did a little bit of a different approach this year in letting our existing grantees submit an application through a fast track process where they could use their application from the previous year and then just give us any updates to what they're proposing for next year, and kind of help them reduce their grant writing burdens and what they needed to submit, since it was going to be a lot of the same things as they already submitted the previous year. So we did that for our existing grantees, and then we had an open competition with the RFP for any new programs that wanted to apply. And we also offered technical assistance. We had a webinar recording that they could listen to that helped them with our portal, our Common App portal. And then we also answered any questions that individuals had. I think we had about 25 individuals reach out with questions about submitting applications. So we helped them through that. And then we end up having 18 existing grantees apply. We have 19 grantees and one chose not to reapply. And then we had 16 new proposals. We kind of do an initial review and then have some outside reviewers look at those and score those. And then following that, and that took place in January. And then following that, we spend quite a bit of time here internally looking through those and reviewing the budgets and reaching out and asking questions if needed. So you have another document that is kind of gives a little bit more information about each of these that are going to be on the next 2 slides. But here's kind of our slate of our existing grantees with the totals that we're recommending. And then on the following slide is our new ones. And we ended up with 8 new ones. Really excited about these. One includes a brand new childcare center that is getting ready to open that we can help support, and then some other kind of a variety of services that I think will fill some gaps that we have in the state and supplement some of our other areas with what is already going on. So we have a total of 22,800 for this next year that we're recommending, and happy to answer any questions that you have about any of them.
All right, I bet we do have some questions. Let me see. Anybody on the cabinet have a question? Is this well, while you guys are getting ready, is the 22.8 the total amount we currently have budgeted for ECBG grants?
Yeah, that's what we have budgeted to grant out, because we have some administrative costs on top of that for doing our evaluation and staff salaries and things like that. So that's our number that we feel is comfortable to be able to grant out.
We did award the full amount that was available within our budget. That's what
Yes.
I meant.
Yes.
Okay.
Yes. Yep.
Anybody else? A few of the existing grantees had what, of course, from the eye of somebody who doesn't have to manage those programs look like smaller increases. Can you give me just in general? I don't really want to probe specifically, but Amy, kind of
Sure.
what was going on there that you
Yep.
were able to do that?
I meant to mention that. So for the fast track, we let them, they submitted a budget for their current funding and then asked them if there was additional funding available, if they, how they would use that funding, and what they requested. And most of them that you see are needing just to be able to continue running their program with increased costs of supplies, salaries, all of that. A few of them are going to add additional services. For instance, Fort County is going to add an extra county to their service area of one of their programs that they're providing. And so it ends up about a little bit less than 8%, I think, increase overall across all grantees. But I looked at all of those and felt comfortable with recommending that we give them their increase based on the budget that they're wanting to what they're wanting to use those additional costs for. And I have another thought just escaped me. Oh, you'll see I think one or two of them are not the amount that was requested.
Right.
What we're
That's
recommending.
what
Yep.
I was really going after.
Yep. So one of them, we're going to work with them. We feel like what they were asking for, there's that service already exists. Somebody else is already providing that, so we can connect them to somebody. We wanted to avoid any duplication. And then another one had a few costs that just weren't really either allowable or also kind of similar, like duplication. So I think there was only a couple that had that were recommending not what they were recommending, similar to their current funding or just slightly more. I think it's the first two actually on your existing
Right.
grantees
I
list.
believe
Yep.
that's
Yep.
right.
Yep.
Okay.
And so for the child advocacy and parenting services, this is still an increase that we're recommending above what they are currently getting.
Oh,
Just not quite as much as what they're asking.
all right. Well, that's helpful.
Mhm.
Anybody else? Some questions here? This is at the core of our business, and I think we need to spend a little bit of time being sure we understand how the process works.
I'm wondering if Amy, could you give a little bit of just some highlights of the new grantee programs,
Sure.
just so that we can share. I think we're excited about several of the new opportunities to serve new areas, correct?
Yep. The first one, Child Start, is going to be serving a new county, Harvey, that we don't have any services currently. They're going to work with childcare providers and helping them just really increase their quality and provide some coaching, things like that, and then help them also with using our common measures to help with improving outcomes for their children and families. The Community Foundation of Independence is the one I mentioned. That is the new childcare center. It'll be called Treehouse, and that's in Independence. They desperately need a childcare center in that area, and so we're going to be helping them support some costs for their classrooms in this first year and training for staff. Growing Futures is in Shawnee Mission, and this is we currently haven't had any grantees in that area. This will be helping to support one new classroom and then existing classrooms and costs to operate. The Kansas Children's Service League is Sedgwick County, and this is they have a couple partners that are providing childcare services, and so they'll be also doing social emotional consultation in those classrooms, and then helping them to do the assessments for the common measures. Lincoln is currently been part of one of our existing block grants for some like supplemental infrastructure, but they've applied on their own because they're wanting to add threes and increase their 3 and 4-year-old pre-K. Phillipsburg Child Care Center was a grantee a couple years ago. They are asking for funding to expand their hours. They're going to add hours in the evening, Monday through Friday, and then open a little bit earlier also. So they're planning to expand their day to help accommodate parents that have a longer work schedule. So we're really excited about that because that's something we know is a big need in the state for those kind of non-traditional hours. Quinter is going to be increasing their pre-K. And then same with Shawnee Heights. They're going to increase pre-K services. And then they're also going to work with some of their local childcare providers so that they can share professional development opportunities and make sure that curriculum's aligned, and so that they can help those children that don't go to their district pre-K kind of be doing similar things that they're all ready for kindergarten. So I feel like we have a good range of new grantees.
Thank you. Other questions?
Yeah, Kim, this is John Wilson. First of all, thanks to staff for the work that you put into reviewing these and being thoughtful about where you could flex on funding, and then also for folks who took the time to submit applications. I really appreciate you all. Thank you for that. I was curious to know for the 16 new applications. Obviously, we didn't fund all 16 of those. Is there a general theme as to what would be the reasons why they didn't rise to the level of getting funding, like duplication of services or geographically too close to other areas or anything like that you can share?
Yep. Some were a duplication of services, so we're going to connect them with an existing grantee in their area that they can partner with. And then some, according to their budget, didn't really have a gap, and maybe they didn't really understand maybe how they could use some of their existing funding to operate without getting the block grant. And then a couple just had costs that weren't allowable, capital expenses and so forth. So I'm going to reach out and connect them with our Child Care Accelerator grant opportunity, make sure that they know about that because that might be a good fit for them. So just kind of a variety, and we'll be touching base with each of them, letting them know kind of specifically what the issue was, and then connecting them to other opportunities that might fit.
And just to clarify, that gap Amy refers to is it's related to school districts that applied, and there is a budget tool that helps them plug in their existing call it categorical aid, the special education funding, 4-year-old at-risk funding, some of the money that they receive as a school district through the school finance budget. That is the effort that we have been engaged in for the last couple of cycles, with partnership from the team at KSDE Early Childhood under Amanda's leadership. We have worked very closely with them to ensure that funding is prioritized in order, so that our ECBG funds for school districts are only to serve the purpose of filling a gap that exists from what they receive in their overall funding through the formula and the just overall but education budget, only after they have managed all of that funding to plug that into their budget. We are funding gaps to provide things that are not otherwise covered. So that's been a really nice partnership with the Kansas preschool pilot grant making process, our ECBG grant making process, and the staff from both of our agencies coordinating effort to maximize the funding that exists for to serve the most kids.
Yes, I want to say thank you to Amanda Peterson, Department of Education at Kansas Department of Education, and Natalie McLean. We met in person a few times to go over some of those school district applicants and make sure that I was understanding the budget. So they took time to do that, and also answered some technical assistance questions as well for the applications.
Amy, I had one more question. This is John.
Sure.
Having never filled out an application for the ECBG program and funding opportunity, I don't know what the experience is like, but I guess I'm a little surprised that there's only 16 applicants, and I wonder if you're surprised. Were you expecting fewer or more applicants? And is it the fact that do you think that there's impression that existing grantees that they're just that viewers of our work know that there's only a limited amount of money right now, and so they're hesitant to apply? Does that make sense?
I think maybe a combination. You also kind of need to find a nonprofit or 501c3 to apply. So if it's a childcare center and they're for profit, then they can't apply. And then yeah, I'm not real sure. I never really know what to expect with how many new applications. This is about what we've had over I think the last several years that we've done an open competition. So a lot of programs are already partnering with our existing grantees that serve multiple counties, and so I think that's great. And a lot of times we try to connect them with one of those if they're thinking about applying, but maybe don't have the backbone support or the capacity to take on the grant, then connecting them with one of our existing grantees so that they can be wrapped into their application is our goal also, so that we can reduce burden on their end, especially if they're a small program.
Yeah, well, I appreciate that. And I know it's not for lack of quality customer service and great support that you all provide to people when they are applying or have questions or whatever. And it feels like in a way that you almost serve as navigators too, that where somebody can't get funding from us, you help connect them to other opportunities. So
Absolutely.
Thank you.
Yeah, that's important to us.
Yeah, I think that's I really appreciate that on the staff's part. And just this is just really fundamental information. When pre-K under state law only serves during the school day and school year, or when I see things like expansion, can that mean they've stretched into evening hours? They're going to move into summer. They're going to open earlier. What are the sort of time operating limits around pre-K, and what might expansion mean? Can you help me with that?
Amanda
This is
can.
Amanda Peterson, and I'll jump
Yeah,
in on that.
yeah.
When we're thinking about state requirements for preschool funding, usually we're talking about the portion of the school finance formula that funds certain children who meet preschool aged at-risk criteria. So that's looking at students who are enrolled on count day. And the way that it works is that districts are required to have programs that are approved by the state board. So we have a set of minimum requirements, but then districts have the flexibility and the ability to build their programming and go beyond those minimum requirements. Districts and state law have the ability to contract with private entities, for-profit, nonprofit, cooperatives, interlocals to be able to deliver preschool services. But the minimum in terms of instructional hours that we require is 465 instructional hours in the year, and districts get to decide how they meet those hours. But that's far less. That's the equivalent to a half day of services for about 186 days of the year. And even if districts serve children for more than that time, even if they're enrolled full day, the qualifying children are only generating a 1/2 student in the school finance formula. So if I'm a district and I would like to shift from having a morning session and an afternoon session to having 2 separate classrooms of full day sessions, I get exactly the same amount of money, but have doubled my costs in terms of teachers and classrooms. So you might have districts who are trying to expand either to be a full school day program or to have morning and afternoon wraparound care, go longer in the school year, provide higher quality services than is minimally required. Does that help?
Yes, but, and so if some of these expansion grants, would you say, Amy, they were mostly just to add a classroom, or were they toward the full day, later hours? Can you help me with that?
Yeah, both. Some were to add additional classrooms, and then someone to go from that half day to full day. Some of these also are going to provide a summer transition program, so that they can do more, provide more services before those children start kindergarten. Some are going to be adding 3-year-olds, and they don't currently serve 3-year-olds, or want to add more 3-year-olds. So it depends a little bit. I'm happy to give you more details on these new ones if you'd like.
No, that's okay. I'm the slow learner here in the group, and I realize that the pre-K expansion, which I cheer, and I'm so grateful for the legislature, it's the right thing to do. But as school districts put these programs together, it does change the dynamics of childcare capacity in the community markedly, depending on summer, longer hours, half day, full day. And I just think we have to keep that in mind as we, strategize around this. So others may have different feelings or other comments, but I'm not sure I was completely aware at the parent level of the issue of half day, no summer, not till 6 o'clock, those kind of hours. And those are parent issues that are real. So, but I'm thrilled with these recommendations. I've asked several questions. Let me just check. Anybody besides John have additional questions or comments?
Yeah, Ken, this is Deanne Graham. And Amy, forgive me if I missed this earlier while I was in transit, but are you guys monitoring year by year the organizations that are applying, and maybe reaching out to those that have consistently applied but maybe didn't this year? And could you just maybe touch a little bit on just kind of from a quantitative standpoint of who there are kind of repeat organizations that are applying or not applying?
Yeah, I don't think we had any that applied this year that we've turned down in the past or didn't receive funding. But yeah, we're connecting them with other opportunities, or if there's already a grantee in their area, connecting them with an existing grantee to make sure that they can partner. Yeah, I'd have to look, Deanne, to see kind of any trends or any thing like that, but I don't think we've have any that are keep applying and then aren't receiving a grant. And we're also giving them feedback about why they weren't a good fit for the Early Childhood Block Grant, whether it was what allowable costs or things like that, so that they can pull together a better proposal in the next year. So I don't know if that answered your question.
Yeah, I think just one kind of add-on is, are there those organizations that in the past have applied and received funding and have not reapplied in this last cycle?
Oh, yes, we had one that is a current grantee that did not reapply. It's a school district, and they just decided that, yeah, it was, I think administratively, it was just an extra a burden on them that they just feel like they can use their budget to cover those the grant costs that they are receiving now. Participating in our common measures was a little bit of a stepping stone for them, I think, as well. And I reached out asking them if there's anything we can help provide more support, and they said no, they're doing better this spring, but I think they just decided to kind of slim down their administrative burden. When you have more grants that you're blending and braiding, it can get a little bit overwhelming, I think, for programs to administratively make sure you're reporting for all of those. And so we only had one that did not apply.
Okay, thank you. Great work. Really proud of all the hard work you guys are doing.
Thanks.
Yeah. Any final questions? I think we would have a motion to approve.
Kim,
Yes.
Kim, Terry is attempting to
Oh,
join. Can we table this, do our next report, and then come back to the vote? Would the voting members mind if we waited for Terry to join us?
This is John, no problem.
Okay,
No problem with me.
thanks.
Elise, are
Sorry.
you okay?
All good. I'm happy to wait.
Okay.
Senator, are you okay? That? You're on mute, so okay, well, I'm okay with that. I just want to make sure we're gonna have a quorum, and with Terry joining, we ought to be assured of a quorum. So, all right.
Yeah, I'm good with that.
Okay, I appreciate it.
Thank you, Senator. Sorry to interrupt your mute there. Let's move on to you know what I think we all are extremely interested in, and that is the report on the home visiting alignment. We know how important home visiting is. We know it's a complicated funding, organizational structure. It seems to involve every agency and government somehow. And so, Melissa, I think we look forward to kind of hearing about the progress and where you think this is going. So,
Thank you, Kim, very much. Yeah, this is an important project that the cabinet at the June meeting last summer made a recommendation that we do an evaluation of evidence-based home visiting models in Kansas and take a look at what we can learn and what we might recommend to take a more aligned approach to, particularly to the funding aspect of the multiple home visiting models that operate with the goal of creating some strategies that will allow us to create more of a continuum of care. So we do have multiple different models that are in place in the state. They are varying types of programs, so varying levels of prescriptiveness in terms of the intensity of the schedule of home visits or the specificity of the home visiting support services that are offered. So it runs the gamut from universal programs that, you know, like Parents as Teachers or universal home visiting, the maternal child health home visiting model that is available just to serve as support and education for parents, to some of the more prescriptive types of services that exist to address particular needs. So maybe it's a kind of service, and forgive me, I'm going to turn around to pull my list of models. It can be services for parents struggling with substance abuse addiction, or it can be you know, families that are in danger of having children removed from their homes. We have things like nurse family partnership. Early Head Start has home visiting services. There's a program called TIES that was operating. I'm not sure it's still in existence. I'm looking at maybe an outdated list, sorry, but universal maternal child health visits, et cetera. So the ABC attachment biobehavioral catch-up intervention is a very specific kind of home visiting service. So we wanted to take a look at how these models are implemented and where services exist. So you'll see the map on screen that really helps show the counties where we have services being delivered. We know that this map shows us that the universal home visiting program is only reaching a little over 2,000 families, 2,039 families. 1,719 children. That mismatch of numbers is because Universal can start before a child is born with some prenatal support. So we see that service being provided. And then there's the needs-based type of programs, which are also reflected on the map. We certainly are serving more families based on need than we are providing just a universal support system. And I think this is one of the areas we want to dig into a little more. I will say that we've learned a lot from what we cannot report back to you, and that, as much as anything else, will be informing some of the decisions that we want to make. What these heat maps are showing really is where services are being provided to families that have certain risk categories. Those categories included participation in the WIC program, Women, Infant, and Children is the KDHE federally funded program. Whether the family had a Medicaid reimbursed birth, inadequate prenatal care, maternal age younger than 20, what maternal education level that is high school diploma or GED, and without any additional types of post-secondary training. Smoking during pregnancy, preterm or low birth weights, and single moms are some of those risk factors that are reflected. So you can see areas of concentration on this map in terms of where the risks are highest. So we wanted to share some observations. When we talk about models, that's not the same thing as programs. So we have 9 models currently in place across the state being used with multiple sources of funding. We were able to count 11, but I think one of those categories is simply private sector or grant funding, which does not do justice to the number of different applications that programs have to file to seek funding from those sources of funding. Public awareness around home visiting, what the service is, what's available, why it might be helpful, and family access vary greatly around the state. I think that's the story we were trying to tell with the maps that we showed you. And home visiting has some of the same workforce challenges that we see with childcare. We see staffing challenges. It's a career track that has low pay. Providers get burned out very quickly. There are limited career development opportunities currently, and home visitors report that they're leaving the field for those reasons. Their caseloads are high, their pay is low, and there is a lack of clarity around how they grow in their given field, which creates a lack of mobility for them. We can't tell you a complete story with the data because each individual program is tracking data in their own way. We as at the state level have not created that form of common measurement that we have applied in our own cabinet work. And that is one of the recommendations that I think needs to be made, is that we create a game plan moving forward to help get to more consistent data being collected. It doesn't need, it shouldn't be personally identifiable when it gets to the point of sharing data, but we definitely need to be able to understand what is going on with these programs and help develop a sense of the outcomes. We have strong data within our own cabinet funded universe of programs, and we've shared that with this board at prior meetings. the value of home visiting programs in terms of holding families together and preventing the removal of children from the home, while also improving the strength of parenting skills and just addressing some of the challenges that can lead to children being removed for reasons that have nothing to do with abuse, but everything to do with situations that can be addressed safely for the children, and again, avoid having to remove a child from the home, which should be only in those situations where a child is actually in danger. We also know that families have trouble accessing the right model of care at the right time. Some of that could be dependent on waiting list situations that exist. So services might be available in an area where the family that needs it lives, but the caseload is so high and the waiting lists are so long that the family is on the wait list long enough that children actually are aging out of qualifying for certain services, as one example of why that can be a problem. So by the time you get the phone call that says, hey, we have room for your child is now old enough that they're beyond the age range for that model. And we certainly know that we have wide areas of the state where services are limited and or non-existent. So there is a challenge for us to get a full picture of the funding, the fiscal state of things at any given time. We can track state funding, we can track federal funding, but the rest of the funding that's helping support is tougher for us at the state level to gain a handle on. So one of the notes here is that this does not mean that less, I mean, it's not we definitely are needing to figure the funding piece out. We aren't serving enough kids to worry about duplication in a large percentage of cases. We have much greater need than we're able to address, and I think we're just really at a point where the work ahead, I don't have recommendations for this board to adopt. I think your role as Early Childhood Advisory Council lends itself to bringing you recommendations in the future. I think another place we might take a report out on the home visiting landscape would be the governor's Early Childhood Transition Task Force, because that task force is taking a look at the fragmentation across the early childhood system, and this study that we've done has revealed the level of fragmentation. I think all of the 4 core agencies, DCF, KDHE, KSDE, and the cabinet, all have funding going to support home visiting. You could see that in our block grant menu of services. So we certainly need to address this across the system, and with the intention of making it easier for the providers that are delivering the programs and services to families also have an easier time, and we address the administrative burden that comes with multiple grant applications and the like. So I don't know that I would say I was hoping to deliver a more robust report with and potentially have recommendations for you. And it seems that we have a lot more work to do before we actually are ready for that. I do want to call attention that in your prep materials, you should have a list that shows the percent of eligible families served by county divided between the maternal child health universal home visiting program as one column and need-based home visiting in the other column. That's where my sense is we deliver far more targeted need-based services than we do offer the universal approach to things. And that's something that I think we can learn from states across the country that have more robust universal home visiting programs. I know there was a state delegation that did a site visit to North Carolina several years ago, pre-pandemic 2019. And that was one of the features of that visit, was learning more about their approach to universal home visiting and the outcomes that they're seeing. So I'm going to stop there and offer time for the cabinet to ask questions. Happy to do my best to answer anything on your mind.
Okay, great. Welcome, Terry. We're glad to have you with us. We held up action on ECBG grants until you got here, so we'll go back to that. But on home visiting, are there questions?
This is Delise, and I don't have a question, just a comment that I appreciate that you're taking the time to delve deeply into the problem to try to define that real clearly before we start looking at solutions. So thank you for taking time to do it well instead of do it quickly. I appreciate the depth there.
Thank you. Yeah, it's hard to know the right answer. We ultimately more needs to happen, and more, I think, particularly on the continuum of care question. How do we make sure that we have a robust approach to referring families to services? Within certain specific programs, referrals get made, but how do we across the board help connect families to that continuum of care when it's called for? And how do we make sure that we are offering services to more families that exhibit need? So that's my takeaway.
I'd appreciate some other questions or comments. I think this is really important, folks. I think it is long overdue and very important. So I join Delise in saying I'm glad they're spending time and effort. But I'd like to hear some other comments from cabinet members about suggestions, concerns, information sources, anything on your mind as you think about this. Because if you don't, I will, and we all know we don't need that. So I'm curious where you are on this.
We have been attending the state home visiting leadership team meetings that occur and working with that group, but we do have need to work more closely with the program, the organizations. There. Okay, I'm sorry. I had a Zoom issue for just a moment. We need to reach out and work more closely with the providers across the state to delve deeper and do some work. We also need to look inward. We need to look at our state level organization of all of this. We've got multiple streams of funding across multiple state agencies. We definitely could do better alignment of those with the right mapping of who the host agency might be for a particular model, and so that's to me those are the key pieces. And then underpinning all of this is the question of data and how we leverage data. I think everybody has their own version of data collection, and we just need more consistency so that it is easier to get at some of the outcome level information and tell instead of saying this particular program has great outcomes, we want to be able to statewide say when we deliver this model, it has these benefits. So those are my goals for additional work.
Well, that would be, I would be in complete agreement with you, Melissa. And I mean, first of all, private funders may have access to some outcome data that they can share on a few of these models. I think that's something to check. Second, I think even assembling the national model expected outcomes would be helpful, because my guess is that, you know, you're going to see reduction in child abuse and neglect some percent nationally. In the next program, you're going to see school readiness improve 40%. I mean, these programs do different things.
Yes.
And then maybe the Kansas model program, or the Kansas programs that do keep good data could be highlighted as showing what the model, when best implemented in Kansas, was producing or something. If you can't get total statewide data, I'm just trying to think of some way to give us a hint. I mean, I've always felt like with home visiting, the first thing is, what are you buying? What are you buying? What are you expecting to have come out of this investment? And so I would look forward to that kind of information. And I would think, you know, should this move toward legislative consideration, that kind of information could be helpful.
I think before we get anywhere near that level of recommendation, we absolutely will address some of those gaps in understanding. I want to give an example that I want to just express appreciation for the partnership with DCF on our pilot study for our data trust. It has addressed exactly this question of whether these types of services are, you know, what the outcomes are that we're seeing. So DCF teamed up. We have a data sharing agreement in place to protect, you know, all the legal considerations, but that's the study that shows that home visiting is the single biggest driver of avoidance of removals and the breakup of families. This is skill building work. This is work that helps parents understand and address challenges that they're dealing with and connect them to the programs and services that can help them. And I would say, and I would welcome, I see Tanya Keys is on the call. If I get this wrong, or if I miss any points, please feel welcome to jump in and embellish. But the Family First Prevention grant funding that Kansas is engaged in is one of the keys where these services are being delivered. And Family First requires, you know, it's a pretty rigorous process to get qualified to be a provider of services receiving those funds. Evidence-based, data-driven. You have to be recognized in the federal clearinghouse and meet certain benchmarks to be a qualified provider. But we are seeing the partnership between that particular universe of programs and our ECBG is really paying off in terms of better outcomes for children and families.
Tanya, you want to add anything to that, or did?
No, thank you. No, I don't have anything to add. I have an update later on more recent boards, but no, I don't have anything to add. That was great, Melissa. Thank you.
Right. Well, I think any of our questions, and especially any of my questions, I can say for sure is I'm a huge supporter of home visiting. I've always wanted the most cost-effective, accessible model to be available to the right people at the right time. And that's all I'm pushing for is your continued work on how we accomplish that in Kansas. And I'm grateful that we're undertaking this project. And anyway, good work so far. And any other final questions? All right, let's return back. If my tech people can help me get back to my vote sheet on the ECBG grant. Terry, I don't know how much of the conversation you were able to hear on that. In brief, I think we have pretty much all the existing grantee proposals that were received were funded at levels that we believe either permit expansion slightly or do not permit harm. Is that safe to say, Amy?
Yes, that's a good way to put it. They're able to sustain what they're currently been doing.
And then we had 16 proposals, of which we were able to fund 8. And we talked about why some of the others were denied. There was some duplication. They didn't really have a gap in funding when we looked at it in terms of all the funding sources available, or they had some costs that were not allowable. So the general overview of this is job well done so far as I can tell. So is someone ready for a motion to approve? Did I already ask for that and then we postponed it? Okay, no. A motion to approve the ECBG grants as presented, or what motion you would like to make relative to the ECBG grants.
Kim, this is Delise, so moved.
All right, to approve them as presented. Is there a second?
This is John Wilson. I'll second it.
All right, you guys just hitting back and forth here. Move second, move second. All right, it's been moved and seconded. Are there any final questions, concerns, suggestions? All right, I will call roll. John Wilson.
Yes.
Dr. Tyler Smith.
She's not on the call.
Terry Rice.
Yes.
Delise Hoffman.
Yes.
Deanna Owen Graham.
Yes.
Senator Renee Erickson.
Yes.
And myself, yes. All right. Well, we thank you for that. And now we're ready for agency updates. What do you have for me on the screen for that to guide me? Well, our own Amy Meek is going to kick it off again. Amy, you've been doing something else besides ECBG you need to update us on?
Yeah, we've been pretty busy over here. Amy Meek with the cabinet. I have a few updates for you. First, I just wanted to mention that it is Child Abuse Prevention Month. You know, we are about halfway through the month, but this is a month where we elevate the importance of creating programs and systems that put children and families first and prevent child abuse. Through our community-based child abuse prevention grant, we're able to fund some activities for this month through the grant to Kansas Children's Service League. They head up the Child Abuse Prevention Month and activities, and on their website, kcsl.org, you can find a toolkit and all their trainings and different things related to this month, and also throughout the entire year. If you see the blue pinwheels anywhere in your community, that's one of the symbols that they use to recognize this month. And then we are taking applications for our early childhood recommendations panel for the next state fiscal year, which will start July 1 and go through June 30th of 2024. So applications opened April 1st, and we're accepting those through May 5th. And really encourage anyone that's interested to go to our website, kschildrenscabinet.org. If you scroll down just a little bit, you'll see a box that has the information about the panel and the application. It's pretty brief, but we are looking for anyone new that's interested in joining this group. And we have a wide variety of individuals, and we want to make sure that we're covering the whole state and different sectors of our early childhood system. So again, those are open until May 5th. So you can go to our website to find that application. And then we have been doing the CBCAP, or the Community-Based Child Abuse Prevention grant. We've been meeting virtually, doing site visits with those grantees. So those have been really great conversations, and finding out how they're about halfway through their grant period, and finding out how things are going, and maybe helping them work through any challenges or any TA that they might need. And then our early childhood block grantees will be getting together in a couple weeks. Wichita State University, who is our helps with our data evaluation for the block grant, is going to be hosting a grantee training and networking event. So we're really excited. It's been a long time since we've all gotten together in person. So excited to see everybody. And then we're also going to be reaching out to the new slate of grantees that you just approved, and invite them as well to join us for that, so they can kind of get a little bit more familiar with the early childhood block grant and also participate in the training sessions. So
All right.
That's it.
All right, any questions, comments? All right, Amanda, you look like you lit up there. You moved your mute off or something. Go ahead.
Good morning, everybody. Sorry, I'm Amanda Peterson. I'm the Director of Early Childhood at the Kansas State Department of Education. And I've got just a couple things to share today. One, I know I've said it before, but if you would really like to stay up to date on all things related to the work at the Kansas State Department of Education, I'd really recommend signing up for the KSDE weekly newsletter that is sent out by our communications team every Thursday. You can do that by emailing ksdeweekly@ksde.org. And that's a terrific way to stay up to date on everything from the State Board of Education meetings. There was a really nice summary of their meeting this week in the edition that came out yesterday. But also the many professional development opportunities that we have available, any possible funding opportunities that the agency might be providing that might be broader than the area of early childhood and what we'll discuss today. To that, the state board continues to meet and work through its goals and strategic priorities for the coming years, as we've had a number of new board members join. And so this week, the state board continued that discussion as they continue to refine what those priority areas will be moving forward. So we look forward to them finalizing that work and expect that that will really bolster our direction as we are working together with other state agencies and working to address student success in the state. Similarly, internally, we are working to consider how we can best support schools to ensure that students have all of the opportunities available to them as they transition into young adulthood. And so internally, we're looking at the areas of structured literacy, balanced assessments, curriculum alignment, and high quality instruction, and really thinking, okay, we know that these are areas that, if done well, make a huge difference for student success. So how can we make sure that we're integrating that into our work from birth through adulthood? So stay tuned for more on that piece. We also, this is the time of year when we are finalizing many of the funding decisions that will affect the 2023-2024 school year. So we've requested to bring our recommendations for funding for next school year to the state board at their May meeting. And we expect that at that meeting, we'll have recommendations for them related to approving preschool aged at risk programs for the following year, which we've talked about a little bit already. And also for approving 2 sets of grant programs that are of particular interest to this group because they're funded entirely or in part by the Children's Initiatives Fund. So we will be bringing recommendations for both the Kansas Preschool Pilot Grant Program and Kansas Parents as Teachers grants from the Kansas State Department of Education to the state board at their meeting. I will note for the group that we are staying tuned to see what may happen in the legislature. Before the legislature left for their April break, they did not pass a budget for the Kansas State Department of Education or for those related flow-through items, which I will note, and I'm sure that others might be very aware of this, or that Melissa might share it later. That does actually include the budget as well for the Children's Cabinet and for the grants that the Children's Cabinet directly offers, as the Kansas State Department of Education is the fiscal agent for the Children's Cabinet. But it also includes, we are staying tuned to see the final amount of funding that is approved in the budget for the Kansas Parents as Teachers program. As a reminder, the Children's Cabinet recommended a $1.3 million increase for that program. And in the conference committee report that was negotiated either late in the evening or early in the morning before the legislature wrapped up, they landed on a $1 million increase rather than a $1.3 million increase. But again, that's not something that's been voted in either chamber. So we are staying tuned to see what the final decision will be there. And I think that those are the two main pieces that I wanted to share today. So if we've got other questions, I would be happy to answer them.
Amanda.
Hi, Terry.
Good morning, everyone. And again, apologies for being late. I don't have a question, but I do want to give you kudos for your team for the newsletter updates. They're very informative, easy to read, and I look forward to getting them. So nice job.
Thank you, Terry. I will pass that along to our communications staff. They do a phenomenal job with those.
Anything else for Amanda?
Amanda, this is Carla, and I want to sign up for that newsletter. Could you put the email in the chat? I wasn't fast enough to write down all of the email, ksdeweekly@ksde.org.
You've got it. Yep.
Thank you.
And Amanda, this is John Wilson. I can't, forgive me, I don't know if you mentioned it specifically in your remarks, but for those who are ready to follow along live with the legislative happenings, they'll come back from their April break on Wednesday, the 26th is when most people return. And the session is currently scheduled to end on that Saturday, but could potentially go longer. So.
Thank you, John.
Yeah.
All right, if there's nothing else, Derek, I've not pronounced your last name, I don't believe. Flairledge. You can help me here. I apologize.
I sure will. That was a heck of an attempt. I got to give it to you. So good morning, all. My name is Derek Flerlog. There you go.
Flerlog. Oh.
Flerlog. Yep. Very, very German. And I always make the joke that my parents really, they really did me a favor with my first name being really unique and my last name being incredibly German. So thanks, Mom and Dad, on that one. I am a co-director for the Family of Bureau of Family Health, if I can get that straight, here at KDHE. Jessie Piper is our other co-director. She's on the call with me as well. And I think based off of the minutes that I read from the previous meeting, we had both not started at that time, but Allison, I think, made you all aware of kind of the direction that the Bureau of Family Health was going, and it seems to have held true. So that is good to see. I started back on February 20th, and I think Jessie started on the 6th of March or 7th of March, something like that. And so it's been a whirlwind of a time these first 7 to 8 weeks for the both of us, and we've met several of you on this call. It's been a lot of fun. It's been a challenge, and that's what I love about it. So really happy to be here. Based off of the updates that Allison gave, I'll just kind of roll through some stuff. And Ashley's on as well. Ashley Goss is on as well, just in case she has anything extra to add. So as far as our programs here on the KDHE side, and specifically in family health, I'm sure you all are well aware that we've started and are well underway with our child care licensing regulation review and promulgation. So happy to report that our timeline, we remain on track for everything with that. And it's been a good process to go through, and we're really, really excited about the direction we're heading in child care licensing. We've had a rollout of a virtual education series that we're holding for providers, and we've sent a flyer out to folks on that. The first one here is, I think, April 24th off the top of my head, and we'll hold 3 different 1-hour sessions that week alone, the 24th, the 27th, and then Saturday, the 29th. So 2 evening sessions to allow our providers after work, and then a Saturday session if that is easier on them, Saturday morning. So, and they can count that hour towards their annual in-service requirements as well. So the first education series that we're holding is we're calling it Navigating the Licensing Ecosystem. And Melissa Schoenberger, our Assistant Director for Childcare Licensing, will be presenting on that. And so we're really excited to roll that out. And then there'll be announcements coming for future series. Again, there'll be sessions in each quarter, and they can apply those to their annual in-service requirements. So excited about that. Got a lot of great feedback from the providers on that too. They're just excited to be engaged, and we're excited to provide that. So small center pilot, continuing to move forward on that. That's another really exciting kind of change to the childcare ecosystem. There's the potential, obviously, for existing providers to sort of graduate into that. And again, that's for providers that are looking to have between 13 to 23, I believe, kiddos in their under their care, we'll say, under their watch. And then obviously, anybody that's newly interested for that as well. So really excited for the small center pilot. That's, I think, truly going to be an awesome thing for the state. And we've got a lot of great feedback on that as well. And then kind of coinciding with that, we have Provider Appreciation Day, which is coming up in May the 12th. So we'll be excited about that too. And Childcare Aware has some good graphics for that. It would encourage folks to share that on social media and bring awareness to that as well. We have completed a couple federal site reviews, I think, since you all have held your last meeting. Just real quick, for our Title X Family Planning Program and our MICV, which is the Maternal, Infant, and Early Childhood Home Visiting, which you folks kind of touched on. Those are both in Jessie's, we'll say, side of the Bureau. Her and I are working very closely together, but she directly oversees those programs. Both went well by all accounts. We've got good feedback with some solid action items, and I think the program managers and staff feel really, really good about where those are headed, based on feedback we received from the federal folks. Other than that, we've had the Governor's Public Health Conference just a couple weeks ago. That was great to sort of get back into the norm of that. Had a lot of great presentations, a lot of good interaction between state staff, local staff, university, academia, all that sort of thing, and really good for us to get that underway once again. We've had our Kansas Maternal Child Health Committee conference just the other day. That was really insightful as well. And then just a few weeks ago, I think, as it's been mentioned, we had the opportunity to sort of give the agency presentation to the Childhood Task Force. So that was a good opportunity to really explain, especially from the family health side of the spectrum, just all of the different programs. And you guys, talking about home visitation, you guys have really hit it there, that we're childcare licensing. That's kind of the big one, right? That gets the attention, but early childhood delivery system is much more than that. There's a lot of programs, and we're working to align those. It's kind of been touched on in this call already. So I will stop talking. Thank you all for having me. I'm an open book and excited to learn, and excited for the future of childcare, our early childhood programs, and just KDHE in general. So thank you for having me.
Thank you, Derek, and welcome. Let me see if there are other questions.
Yeah, Kim, this is John Wilson. Derek, thanks for being here. Again, welcome to the KDHE experience. I just wanted to make sure that I heard correctly. So all the agencies were required to do a comprehensive review of regulations, and in your case, health and safety regulations for childcare. Did I hear correctly that we are way ahead of schedule on that review, and that should be done imminently?
I'll say we're on track.
Okay.
We're on track. So we're reviewing the regulations. We're deep in that process, meeting several times a week and working through the regs. We're going to have, obviously, public feedback will be part of that. There's been some work that's put in prior as well that we can lean on. So we remain on track for the promulgation process. So which I'm obviously learning about and leaning heavily on our subject matter experts in childcare licensing. And so, yeah, we're excited for that, John. Hopefully answered this.
John, this is Melissa. To clarify, are you talking about the statute that passed the law?
Yes,
that's
yes.
You want to clarify that for the group?
Me or Derek?
You, I think.
Yeah. So my understanding, because yesterday is long ago, let alone last legislative session, but the legislature passed law that required agencies to do a comprehensive review of regulations, recognizing that regulations have an impact on businesses, on individuals, and so they wanted to make sure that those regulations are meeting the needs of the regulated communities. And so my understanding is there was a window of time given to us to do that, and it sounds to me like what KDHE is doing is faster than what the legislature has asked for.
Yeah, I think the deadline overall is next year in summer of 24, and so this
pointing to Ashley's comment, Melissa, Ashley just commented that this is separate from that. So there had been plans in place even prior to my start to review these regulations and move forward with that. So
great.
Yeah. Thanks.
All right. Anything else for Derek?
I would just note that our preschool development grant is helping support this childcare licensing review. So just noting that.
Okay. Seems like a good one-time thing to be supporting. All right. If there's nothing else, Tanya, it's your turn.
Hi, everybody. I'm Tanya Keys. I'm with Department for Children and Families in the role of Deputy Secretary. Just a couple updates today on some exciting awards that the agency did in February. In the chat, I did put in the press announcements that we did. So if you're interested in seeing the full list of awarded grantees, you'll be able to do that if you don't already know who they are in your community or haven't heard. But we're excited to announce Family First prevention grantees, and of those there's overlap, as Melissa mentioned, with parent skill building and specifically home visiting. So within the Family First grantees, there's overlap with the Healthy Families America program, and also Parents as Teachers, which you all are familiar with. So 3 of the grantees are Parents as Teachers Association, Great Circle, which in April is being assumed by KVC, if you've heard of their organization, but they're doing Healthy Families America. And then certainly, as you all are familiar, Kansas Children's Service League does Healthy Families America. So that's the overlap with that. And those are continuing from the prior years. So they are established Family First prevention grantees in those different jurisdictions. The other piece, we're excited, and I don't think last time we met that we had announced the Family Resource Center grantees. So I put that link in there. We have 10 Family Resource Centers that were awarded, and what's kind of neat is to see the overlap between those and the ECBG. So there's a couple of providers, partners who overlap. So that's kind of neat that we're able to braid funding for that so that they can do more in their communities. Those are today really the only updates I had. I think we had been talking about those 2 items being in the request for proposal process for a long time. So we were able to announce those around Valentine's Day. I'm happy to answer any questions.
Anything? Now, if we had Family Resource Centers statewide, maybe we could coordinate home visiting through Family Resource Centers.
There's a thought, Kim. This is Melissa.
Yeah.
Tanya, just to clarify, within the grants that Family First is funding for home visiting, those, it's my understanding, can you confirm that it requires a specific referral from DCF for a family to connect to those services? So it is something of a separate group of families that are receiving those. So it's the same, that's an example. It's the same model, but it's a program unique to that funding stream, correct?
Yes. So the gateway for Family First referrals, and it's specific federal funding that's matched, but the criteria is the child needs to be in a family where the child is at risk for foster care. So that's the specific eligibility criteria. And those referrals, then the origin would come from a DCF employee. So it's a resource that we're facilitating because that family has come into contact with DCF, and we have some federal criteria that we have to meet, but it's really about, if that family is at risk of a child entering foster care, that's what our prompt is, so that we can surround that family with that service. And certainly the age group as well is a criteria for that program.
Thank you.
All right, Carla.
Good morning, Tim and everyone. I'm Carla Wiscombe. I work for the Kansas Board of Regents. And the thing that I'd like to report out today is that Flint Hills Technical College has been approved to offer an early childhood education program. And it was also approved by the Promise Act. And I've talked a lot about the Promise Act, so I'm going to put the link for the Promise Act in the chat so that all of you that are interested can look at the scholarships and the dollars awarded and the deadlines for that. The other thing I wanted to share is kind of high level, not specifically pertaining to early childhood, but we will be looking at math pathways for all of our bachelor degrees and associate degrees. Currently, most of our bachelor degrees require college algebra, and that may or may not be the appropriate math course for that program, but it's kind of the easy one that everybody has checked off the list. I know that personally myself, when I got my bachelor's in elementary ed, a statistics course would have been much more beneficial when I was trying to explain test scores and different things to parents. So the faculty will be looking at that and determining which math course, either college algebra, elementary statistics, or quantitative reasoning, is the best math course that will help those in their program. So that's what the Board of Regents is looking at. We're looking at a fall 26 implementation date of that, but it will take a while for all the programs to determine which course is the best practice and the best practical course for their particular programs. And that's all I have.
Awesome.
You think history poli-sci majors can just be exempt from math? Is that a possibility?
No, they have to have something.
Oh, darn. All right. Hope springs eternal. All right. Dina Russell Marino.
Good morning, and thank you for having me. I'm here on behalf of Justice Wall to give you an update on the Kansas Judicial Branch. We have a lot of trainings that are coming up that we want to make sure you're aware of. We are about to implement our third session of our juvenile justice webinar series that will occur on May 26th. And I can put that information in the chat for you if you'd like. That training will be on toxic stress and the LGBTQ youth community. It will focus on their identity and the discrimination that they encounter. We will also have our best practices training in August. We just wrapped up our best practices spring training, which was on substance abuse. Our August training will be focused on older youth, and that will be a hybrid training. So we will have some seats in person, and we will also have Zoom capability for that as well. We have also put out the new code books, the 2022 Sync and JO code books. Those are available from us if you need them, but also online on our website. CASA programs across the state and chief CSOs across the state are distributing those to our local attorneys and judges as well. And then finally, one thing that's new, next year we plan to host a child welfare summit. This summit will take place likely in April. We're in the early stages of development of this summit, but the purpose of the summit will bring providers together to talk about challenges, barriers, and also wins within the child welfare system so we can collaborate better and address some of those issues that we all know exist, but maybe we haven't connected to start dealing with those together. So I think that's all for me. Thank you so much.
Well, Dana, we appreciate you stepping in for Justice Wall, and it is at least as a fully recovered lawyer, it is really, I'm really pleased that you're providing these kind of trainings, because I think it's so easy sometimes in the judicial system to overlook the particular needs of the child welfare side of the justice movement. So appreciate what you're doing there. So, okay. Matthew Billinger, I guess you're going to talk from corrections and juvenile justice. Good to see you again.
You too. Thanks for having me. So I'm Matt Billinger with the Department of Corrections. Much like other state agencies and groups in the community, we spent a lot of time in the last few months working with legislators on a variety of bills and during this legislative session. There's some that were supported that didn't pass during this session. I think those conversations are still going on. Some of those include eliminating fines for juvenile cases, opening up opportunities for juvenile crisis centers, and creating more funding streams for community programming. One of the bills that did pass, I wanted to kind of highlight, was renaming the Joint Committee on Corrections and Juvenile Justice Oversight. And that bill names the committee after Representative Russ Jennings, who was well known in the juvenile justice system, put a lot of good positive work in the system, big advocate for creating alternatives to incarceration and helping those justice involved youth. And he unfortunately passed away in 2021. And that bill was just signed into law yesterday by Governor Kelly. So I wanted to point that out. Russ Jennings was a big advocate for helping those justice involved youth.
Matt, I would just, not to interrupt, but Russ actually served on the Children's Cabinet during his tenure as the head of the JJA when it was a standalone agency. So he was the cabinet agency appointment. So I would just note that. That was a really nice thing to see pass unanimously through the legislature in both chambers. So.
On another happy note, Megan Milner was announced as the Deputy Secretary of Adult and Juvenile Community-Based Services. So she replaced Hope Cooper. She's been in the justice system in Kansas for quite some time. She's going to be leaving the role of superintendent at the Kansas Juvenile Correctional Complex. So she will officially take that position starting April 30th. Juvenile services within the Department of Corrections, working on a lot of statewide programs for the juvenile population, including family engagement, mental health first aid, gender responsivity, working with crossover youth, and working with the juvenile defense teams to kind of work up their defense strategy or their defense possibilities. And they're all those programs are in various stages from implementation to aftercare and sustaining. Family engagement program is probably the one that's newest. Still doing some data collection and work and implementing that to get that taken off the ground, but it definitely deals a lot with what we've heard already today about working directly with families and not just the youth that's under the justice system. So working a lot with parents and that family environment. April is also Second Chance Month for the U.S. Department of Justice, celebrates the importance of helping individuals, communities, and agencies support a successful reentry into the community after a period of incarceration. So we've had some recognition to our reentry teams, both in the juvenile and adult world, that do work with those individuals coming out of incarceration into the community and getting them back on their feet and going again. Lastly, the Juvenile Justice Oversight Committee. I've spoken before how we kind of created some new grant opportunities, and I shared a lot of those opportunities with you to kind of help spread the word. We're happy to say that we did garner a lot more interest than we have in previous years. We got applications from organizations that never applied before. So thank you to those of you that helped spread that messaging for us. In years past, we have finished that kind of grant season with money still left on the table to be awarded out, but without the applications to do that. So I don't think we're going to see that this year, which makes us pretty happy that we can get those dollars out into the community. So I want to give a thank you to those of you that helped us spread that information out. Thank you.
Yeah, well, any questions for Matthew? Again, it's always It's always good to feel the coordination going on here. Somebody.
That was me, Kim, Melissa. Matthew, yesterday I had the pleasure of sitting down with the director of the Kansas Big Brothers Big Sisters organization. We had a wonderful chance for me to hear an update on the program in Kansas, and it just looks to me like, I mean, it's a little bit out of our cabinet wheelhouse because we focus on birth to 5 age range, and their program starts when a child turns 5. But she explained that they hit the wheelhouse that is secondary youth development and tertiary youth development. So primary is activities that are just available for all youth, such as, you know, some of the after school programs like Boys and Girls Clubs and activities like that, youth sports and other types of mentoring opportunities. They come in when there is a need for some mentoring, when it's kind of that risk pool, that secondary risk, when maybe the youth isn't yet involved with the system, but there are some indicators that they're headed that way without some intervention. And then the tertiary is once they've had some interaction with the juvenile justice system and are involved. This is part of the process of helping address some of those issues. And then once you know they are detained or have a certain level of offense that they commit, this is not a program that has the right training to be involved, so it becomes more of a corrections department level situation. But I guess that's a long introduction to the question of whether it seems like there might be opportunity with our newly designed juvenile justice approach to wrap the Big Brothers Big Sisters into the mix. So I just wanted to flag that Mary Shannon is the president and CEO, and I would strongly encourage some conversation around how we might strengthen partnerships.
Yeah, mentoring is definitely a big push for us. A lot of the grants that we reviewed this last week had a lot of mentoring to it. So we're definitely very supportive of that. So I will kind of pass that around our circles as well.
Perfect. Thank you.
All right. Well, Leetta, I forgot to welcome you. You've been with us for 30 minutes or so.
Thank you. Sorry I was late.
Tell us why you were late, Leetta. I am so proud of you.
Hear what happened here.
Thank you. I was presenting my dissertation proposal. It was my defense, and I'm officially a doctoral candidate and get to begin my research. So thank you.
Congratulations.
All right. Congratulations. All right, Melissa, I think we, unless there's somebody else from an agency not on the screen, we're ready for your report.
Perfect. Thank you. Well, I will start with just some brief updates around the legislature. You heard from Amanda a piece of it. I will say that the way the Children's Initiative Fund budget is set up in the state budget, part of our CIF plan has passed. So in the baseline budget bill that did pass the legislature last week, the line items that flow to DCF and KDHE have gone through. So that would be the family preservation match that we send, the child care service, which is the subsidy program, we provide a match. So those both are approved to go to DCF. And then KDHE, our home visiting, our the infant toddler, it's the Part C services, the state match share that we provide. Smoking cessation, it's prevention efforts. There's a grant that because of the tobacco funding we are responsible for, and then the SIDS network. So those are all through the budget process. It is, as Amanda pointed out, the portion of the CIF that is tied to the Department of Education. I do want to give my thanks to Senator Erickson for the work in the conference committee, because the House position was different than the cabinet recommendations. And Senator Erickson, we appreciate the work to get the Senate position mostly through with just the minor tweak to parents as teachers, but we're very appreciative of the work that went on in the midst of everything else happening to defend the Senate position. We also have a proviso that went through that we had a bill that would authorize the cabinet to create a 501c3 entity for the Dolly Parton Imagination Library project. That bill, there was a Senate version and a House version with identical language. Each chamber passed their version unanimously off the consent calendar through that process. One of them had to cross through the other chamber to become law. And we made it to day 3 on the consent calendar, and then the bill got pulled off on the Senate side. So as a workaround, there's a proviso that went through that we will still have the authority to get to work creating a 501c3 vehicle. So again, we're appreciative of the effort that went into helping move certain items through the legislative process. I think the next item of note is that we had the first meeting of the Early Childhood Transition Task Force, which was created by Executive Order 2301 issued by the governor. The first meeting was held on March 31st, and it was a chance for each of the 4 key agencies to take 30 minutes to provide an overview of the early childhood programs that reside within our particular agency, and then address our thoughts on opportunities and challenges and evaluation and data related topics. So it was a good, healthy afternoon of discussion, lots of questions. And just to remind the public, the mission is to create a framework for a transition to a model that is a single agency governance structure for early childhood programming, so that we can better consolidate initiatives and funding under the leadership of a new cabinet level, meaning governor's cabinet level position. So the vision is to ensure that all Kansas children, particularly those between 0 and 5, because they deserve healthy childhoods that are supported by a robust early childhood system that improves outcomes and effectively provides high quality early care and education, and adapts to the needs of families and communities, and provides equitable access to all communities across the state, that we need to take a look at the way we are organized. The Hunt Institute has been engaged to facilitate this process. The next meeting has been scheduled for May 16th, at which time Hunt is going to bring in some folks representing other states to share more about models that are working successfully in this realm. We will then have a series of regional stakeholder meetings that they anticipate taking place the week of June 26th. I think there will be, I think 6 is the intended number. So 6 regions in the state plus a virtual session, I believe, to make sure that everyone interested in attending and providing input has that opportunity. There will be an August meeting, which is going to be more of a work session and a review of all the stakeholder feedback. And then the goal is that in October, there will be a meeting to review and refine a draft report and do any final work to be ready for the adoption of a final report at a meeting in mid-December, so that the report can be conveyed to the governor and the legislature as needed. So that work is it's actually a nice next level to the preschool development grant work that has been going on. I think we've been working to collaborate within the system that we currently operate, and I think, you know, there's good opportunity to create a plan. I don't know. I think there are different versions of this type of model, and that's what we're eager to learn more about. So stay tuned for more updates and reports back to you all at the cabinet. The other big news is that our childcare capacity accelerator grant opportunity went live. So that RFP was posted last month. It will remain open until May 15th. We have provided multiple training webinars so that people have an opportunity to bring questions as they begin working with the parameters laid out in the RFP. I just want to make clear that we are very willing and available to offer technical assistance when a community sees certain criteria as a hurdle to get over. We want to make sure that we are connecting those communities to as much technical assistance and support as we can to navigate the process successfully. To remind the group, this opportunity is available statewide. It is a grant from the SPARK allocation, that's the State Fiscal Recovery Fund. The cabinet received $20 million that we will use to address capital improvement projects. So major renovation or brand new construction that leads to additional physical space for more slots for children. So what we will not award is funding to just upgrade an existing facility for that will only serve the same number of kids they currently have. That is not the goal of this. The goal is to add slots for kids across the state. DCF transferred us $20 million to match up and braid in funding to help with the general startup costs that such new programs will incur and some of the operational expenses that are involved with growing a program. We've also got a tab, like a section of the RFP for innovation grant funding. This is to fill what we thought might be a gap between programs that exist that don't need fun, that aren't growing physical spaces, so that construction side isn't relevant, who maybe it's different than startup operational costs, but there's innovative approaches to recruitment and training and staff development, or models like the small center pilot model. We want to leave space for innovation to be funded within the acceptable guidelines of the source of the funds. So you may not need construction dollars, is my point, but you may still have reason to take a look at the RFP and see if your program should be starting an application. As of a couple days ago, we see 105 applications in the works. So those are open applications within the grant management platform. We've received well over 100 letters of interest when we made that call, and it was when we tallied up the dollar amount of the asks that were expressed in those letters of interest, it was $90 million. So we have less than half of that funding. So stay tuned, because this is a very competitive process. We've fielded some calls, and the message I want to help share is that even if there are certain elements of the grant that may feel like a barrier, and I'm thinking specifically of state fire marshal sign off on new plans, that is one that is most commonly expressed as, hey, we're not that far along. I want to make sure that people understand that it doesn't mean you can't apply. With the amount of applicants that we anticipate, it may mean that on the review criteria, if you've lost points there and we have projects that are that far along, that means they're ready to put the shovels in the ground. They've got the sign off on all the stages of planning. It's pretty far along in the process, but we don't want to say, nope, you aren't eligible to apply. We want to evaluate the general readiness of projects around the state and be ready to fund those that are the most logical to fund. But it doesn't mean that we're not going to continue working creatively to try and figure this out. We still have another application to the feds for a source of funding that would potentially fund construction. It's not as far along as having, knowledge that yes, we're going to receive this award. So please work with our TA team and let's try and achieve as many successful applicants as we are capable. As I mentioned, 5 p.m. on Monday, May 15th is the deadline for the electronic application to be submitted through the Good Grants platform. We will take the period between May 16th and June 9th to review. We have, we're putting together a review team of, and I'm pretty excited at the roster of people who have agreed to lend their time and expertise to review applications. So we have reached out to the construction industry, we've reached out to other types of philanthropic organizations. We have some folks who do this kind of work in other states that we have on our list. We want to make sure that we have a review team that is up to the job of reviewing and scoring this magnitude of applications. We are proposing a Children's Cabinet board meeting, a special June meeting. We're not going to be ready for the regular June meeting, but we want to make sure that we review recommendations and make award decisions as quickly as we can. So my question for this group assembled from our voting members as my main audience here, would the morning of Friday, June 23rd work for a special meeting? I think it could be shorter because we'll dispense with some of the regular items of business. The special meeting will simply call to order, review the grant applications, have as much discussion as you need to feel good about decision making, and then the vote. So, I think as short as an hour of your time, depending on, certainly I will clear the morning to be ready for longer discussion, but if you could let us know, and maybe what I'll do is, if you need time, you can email me, but June 23rd, 9 a.m., does anyone have a problem with that special meeting date?
Melissa, it's John Wilson. I have a board meeting already scheduled for that day. It's our annual meeting, so that goes 9 to noon. 9 to noon. What if we pivot into the afternoon? I can make that work. Does anyone have a problem with, say, 1 p.m. on June 23rd?
I can join. I just will be en route, so we'll just need to probably join by phone or be off camera. But I can participate in the afternoon.
Okay.
And just to confirm, this is in addition to the scheduled second meeting. Okay.
We will have a regular June meeting, but I need us to have a special meeting to approve the Child Care Capacity Accelerator Grant Award slate. So I don't hear other conflicts with June 23rd at 1 p.m. I will send the cabinet an email so that we also catch responses from the members who are absent today. But let's tentatively aim for that, and we'll do an official notice to you, and then all the proper public notices once we have nailed down that time. We, as part of this major grant award program, I do want to acknowledge that Lucas Neese has joined the cabinet as federal project manager. He is specifically managing the accelerator project. So out of that 40 million, we are supporting Lucas's salary as our admin burden to this. So we're keeping it as low as possible, but we did need additional staff resources because of the size and complexity of this funding program. He's hit the ground running. Lucas comes to us having previously served as the assistant city manager in Lindsborg, Kansas, and I was impressed with the work that Lucas did for the city to help them identify how to address childcare needs, do the necessary planning, the requisite fundraising, because that certainly wasn't in the budget, and he successfully guided that project to opening. I think served on there, maybe still does serve on their board, but he brings great experience, and his knowledge and his network of connections have served us well already. And then in terms of staffing, we have had a job posting to fill an open position upwards of 6 months. We've been seeking applicants. I am really excited to let you know that we have hired, we will be welcoming a new staff member May 1st to help with the core portfolio of work that the cabinet engages in. So we have finally filled that open position. So at our June meeting, we can introduce our new staffer. We are hard at work with preschool development grant, dual grants now in play. So last week we were notified by the federal project officer that our existing 3-year grant, which is scheduled to end, the award end is April 29th. So later this month, but they offered a no-cost extension, and we applied for that. So we have use of those funds for 1 more year. It'll be April 29th, 2024 is the final date. It just gives us time to wrap up existing projects. It is not, we will not start, we're not allowed to start anything new, but in recognition of the impact the pandemic had on timelines for activities across the country, they have offered a no-cost extension. We will use that time again to wrap up the final phases of existing projects. I think our team feels like there's a certain number of projects that will be wrapped up much sooner, but we decided to apply for the full time frame just in case, because we only had one chance to apply for an extension. So we look forward to wrapping those things out appropriately rather than rushing to some arbitrary conclusion in a few weeks' time. At the same time, we've got the planning grant underway. The major activity going on right now is a brand new comprehensive statewide needs assessment. So we've been gathering reports from existing agencies and compiling data from a huge array of sources to help inform that needs assessment. We've been doing work to frame the goal of the report. I think you will see it looks very familiar in terms of the organizational structure. The same key areas will be the focal point. We have done small needs assessment updates each year of PDG, so this will be a chance to provide a richer context to the needs of our system. stay tuned. We will be ready. We won't present this until later in the year, but we will be using it to update the strategic plan, the 5-year strategic plan. We have lots of great accomplishments since we adopted our strategic plan in spring of 2020, and some new direction based on progress made. So we're excited to update that. That is all. It's also, the planning grant is helping us support other types of analysis. So we are revisiting the fiscal map that we began working with in the 2019 planning grant year. We are doing our own internal gap analysis, such as the home visiting report. So we've got a bunch of really exciting work that's happening. Moving on to the Dolly Parton Imagination Library, I brought you up to date on the 501c3 project. We have welcomed Lane County. I think just this week we announced publicly that they've gone live. Their local community foundation is our partner, and we're really pleased to make that connection. We continue to have some programs that are in process that are they're committed. Those 3 counties on the map are committed partners. Generally speaking, it's the application to the U.S. Postal Service that has to be processed on that end of things. That is the hold. We are on hold until they approve the application, and that is entirely tied to the mailing of the books, the postage rate that we seek. But we are on track to welcome 3 more counties to the mix. We have partial coverage on the map in the counties that are shown in yellow, and no coverage in the blue counties. So our focal point is to really lean into how we bring the rest of the geography in the state on board. We have partial coverage in Johnson County. It's the Shawnee Mission Education Foundation. So their school district education foundation is our partner. They just signed up September 22nd, and I saw their update last week. Their goal for their first year was to get to 1,000 kids. They currently have over 3,900 children signed up. They've given, I think they calculated 23,000 books since September have been mailed to children in their school district attendance footprint. So we are really working hard to cultivate additional partners in Johnson County to get the rest of it covered. I also am really focused on how we bring Wyandotte County on board. And I focus on these because these are, big population centers. And in the Wyandotte County case, we have a pocket of intense need. So we will continue to cultivate partnerships anywhere we can. Sedgwick County is another one. I think the core of the city is covered, but some of the outlying areas of the county need partnerships. So we are not overlooking these areas that are partially covered in our efforts to gain more partners. One of the things that I have going on, I'm working to book a meeting with the Johnson County the chair of the county commission to explore some thoughts with him on how we might bring some partners on board. I have received some referrals. We've reached out in Comanche County based on a referral we got from a lawmaker in that area, which we greatly appreciate. So I again re-up the call for thoughts on who might be local nonprofit. They need to be a 501c3 partner or an organization that has that status that might join us as in partnering in some of in these areas to fill the gap. I'm open to some creative solutions. So that is our mission, to get to all of 105 counties. We currently are sending books to over 48,500 children every month. And so this is just an incredible effort at improving literacy and fostering a love of reading across the state. We are talking with the Dental Association and the Pediatricians Association about partnerships. Once we get this map to be all green, we will have the ability to partner with organizations that can help families connect to the opportunities. Other states use their WIC program to focus on families that are lower income. We have introduced the idea of partnership with the hospital association. So we have a lot of creative ways we can team up to spread the word, but we don't want to be doing that when there are still pockets where nobody has ability to sign up. So I think I'll stop there and hope that if you have questions, you are welcome to run them by me, and we can move on to wrap up.
I think there was a question on chat that really needs to be brought out, and that was, can these books be distributed through schools?
So the way the program works is to get the parents sign up directly, and there needs to be a mailing address. So we have been wrestling with how we create a system where we could, for example, serve foster kids. The problem is there is often a high rate of movement among that population. So it's hard to know what address. We've asked that question of, could the school district be the address of record? And that is not how the Dollywood system is set up currently and on their end in the book ordering system. So we're wrestling with that. Schools are welcome to publicize the program as an opportunity for parents, but it wouldn't be the schools doing the distribution per se.
Okay. Any other questions or comments on Melissa's report?
Melissa, this is Deanne, just to piggyback on what you were just saying, is that something the Department of Education could notify each of the school districts of the opportunity, and kind of what is that flow, the workflow of how that information would be shared?
Yeah, it is something that we absolutely will use channels like that to publicize. Dollywood has ability to the sign up process can be done by scanning a QR code and it takes you to the online portal, or you can go right to their website and navigate it that way. We have done some sign up sessions in some of the areas that have full coverage where, I mean, it takes 2 minutes for a parent to sign up. It's very basic information. It is purely parent choice to sign their children up. So we can we've got a bookmark that has the QR code and the basic information about how to find the signups. So we can make materials available for use. I think local programs often do this. We've got the Dane G. Hansen Foundation covers 26 counties in Northwest Kansas. They actually order The Little Engine That Could is the first book that a child receives, because that is Dolly's favorite book, and she finds the inspirational message to be worthwhile. So she's adopted it as the first book to welcome a child to the program. Dane Hansen, I think they're the program that pays to print those books and equip the hospital with that as a gift to families that have a newborn in their hospital. So I think there's a lot of opportunity. We just have to clear the hurdle because it would be hard to tailor a rollout of a promotion and have families in that number of areas find out when they go to sign up that they're ineligible. So that's been my hesitation to to doing that concerted statewide effort, but it's coming because we're making progress. What the United Way of Kansas is working towards helping partner in a couple areas. We just aren't ready to announce yet. So we are actively working to turn the map all green. So stay tuned.
Great work.
Thanks.
Anything else?
Kim, I would just note we've had an awful lot of links that have been put in the chat. So we'll have staff post when we post the meeting materials. So the recording, the slide deck, and then all of the handouts that the cabinet members received get posted online on our website. We'll add a document that is just the inventory of links that have been shared so that members of the public have a way of accessing that information.
Okay, sounds good. Any final comments from cabinet members? Are we ready to adjourn? Our next meeting would be June 2nd. It's anticipated to be held virtual. And then we would have a special meeting on June 23rd, subject to, I think, Melissa's circulation to be sure that there aren't other problems that we didn't that people here didn't identify. Although I think we're within one or two of everybody being on. So
yeah, I think we should be good, but I will document that, and most importantly, we will make sure there's a calendar invite so that gets locked down, and I think even I have had those experiences with our own meetings where I don't have the link on blocking the hold on my calendar. So we want to make sure that everybody reserves that time. So we'll get.
When you put the links on, would you put the link to the Child Care Capacity Accelerator
Yes.
RFP as well?
Yes, that for sure.
Okay. Anything else?
Kim,
Yeah.
Kim, it's John Wilson. At the risk of going on a few more minutes, I wanted to highlight one more thing. Melissa in her comments mentioned the proviso around the Dolly Parton Library, and I wanted to highlight two other provisos that are included in the budget because it relates to prior recommendations from this cabinet about making sure that that the state does all it can to help families meet their basic needs. And so the two provisos I wanted to highlight were one that addresses an error with the Children's Health Insurance Program. We're the only state that ties eligibility to a specific year in statute. In this case, it's 2008 poverty level to be eligible for, or it's a percentage of the 2008 poverty level to be eligible for the Children's Health Insurance Program. And so there's been a proviso put in to adjust that so more kids remain eligible and kids don't lose their coverage. And the other has to do with increasing the cap for the newborn screening program. As I'm sure many of you all know, when a baby is born in Kansas, there's a series of tests that are performed to screen for diseases, and costs for those tests have been going up year after year, and new tests have been added to the screening. But there's been a cap built in, and there's a proviso to raise that cap in the budget for the next couple of years, actually. So that's really good because we know that when we don't invest in the health of young people, we undercut our investments in their early education as well. So I'm really excited for that to be the case, and look forward to the day when those can not be provisos, but actually be permanent fixes.
All right. Thank you, John. Good progress report. Now, is there a motion to adjourn?
So moved.
I hear it from Deanne. Is there a second?
Yes, second.
All right, we got two new names in the minutes. That's good there. All in favor, say aye. Aye.
Aye.
Opposed? All right, we are adjourned. Thank you all for a good meeting today. Bye-bye.
Thank you.